Thank you, Shivani ma'am, for your kind introduction. And I would like to thank organizing committee for inviting me to deliver this lecture on role of artificial intelligence in clinical biochemistry. And I hope my presentation is useful to all the postgraduate and all the members. So I will be covering basic concepts of artificial intelligence that will include AI versus machine learning versus the deep learning. I will also include the application of machine learning in clinical biochemistry laboratory with the references and the challenges with the use of artificial intelligence and optimal way for implementation of machine learning and artificial intelligence. So this term artificial intelligence is defined as a theory and development of computer system which perform tasks that normally require the human intelligence. This term artificial intelligence was originally used by the founding father of artificial intelligence, that is John McCarthy, in 1956. So it is not a new term. The application of artificial intelligence is very much in our day-to-day use now. We know that the Alexa, the Google Assistant, Siri, the voice command system, they are based on the artificial intelligence. The Netflix, the Amazon Prime, the streaming platforms that use the artificial intelligence. So based on your watch hours or watch the movies that you see, the AI, the machine learning will automatically suggest you the suggestion as per your watch hours. The LinkedIn, the Facebook, the social network that use the artificial intelligence. So based on they will provide you the suggestion, friend suggestion, or like Twitter or YouTube video. So in YouTube, when you watch what particular category of video, the YouTube will automatically show you suggestion regarding the video. So there is all about the artificial intelligence. So AI can be used for the traffic prediction, for the speech recognition, for the image recognition, stock market predicting. So there are many use of artificial intelligence. Tesla, the company self-driving cars, they are also based on the artificial intelligence. So we are focusing more on the artificial intelligence role in the medical diagnosis. So as for so far the artificial intelligence, the development in the medical science is mainly in the radiology, in the surgical and oncology. But in last 10 years, there are many papers are published based on the laboratory medicine, artificial intelligence role in the laboratory medicine. So you can see the rate of publication is exponentially increased. So he's Mark Cuban. I'm taking his quote. He's a billionaire who appeared in the US Shark Tank, similar to our Shark Tank India. So he quoted that artificial intelligence, deep learning, and machine learning, whatever you are doing, if you do not understand it, then learn the basic of it, because otherwise you are going to be dinosaur within 3 years. So you will be extinct. So this is why now as a laboratory professional, we should learn about the artificial intelligence. We may not able to learn it, we may not able to perform it or do it, but at least we should know the basic concept of behind this artificial intelligence, so we can apply it in our day-to-day practice in laboratory medicine. Even the European Federation of Laboratory Medicine, EFLM, they have introduced the working group on artificial intelligence. Also the Germany, the digital group, they have made the working group for the digital competence, the strengthening the digital competence in the laboratory medicine. This is a Journal of Clinical Chemistry and Laboratory Medicine. They have issued a special issue on artificial intelligence and big data in laboratory medicine, and it is publicly available also. What is AI versus machine learning versus the deep learning? So artificial intelligence is the ability of a machine to imitate the intelligent human behavior, while this machine learning is a subset or subsection of the artificial intelligence. Here it is an application of AI that allows a system to automatically learn and improve from the experience. While the deep learning, it is a subsection of the machine learning that uses a complex algorithm and deep neural nets to train a model. So the types of machine learning, there are basically the 3 types of the machine learning. One is supervised learning, second is unsupervised learning, and third is reinforcement learning. In supervised learning, based on the problem, it is further divided into the classification and regression. Here, in the supervised learning, the learning is supervised by the humans. Okay, so the data, they are labeled in supervised learning. While in case of unsupervised learning, the data are not labeled and they will be differentiated based on that. So the main classification in unsupervised learning is clustering, while in case of supervised learning, it is either classification or the regression. While in case of reinforcement learning, it is a learning from the mistake. It is just like playing games, and mainly this learning is used in the robotics and also in the games. So the supervised learning here, it is supervised by the humans. So suppose these are our data. So the characteristic or feature of it is the shape, the different shape. So as a human, we give the labels like this is a hexagon, this is a square, this is a triangle. And when we feed the data, when we train the model, then when we add our test data, machine will automatically predict that this is a square, this is a triangle. So this is a type of supervised learning, which is a type of machine learning. So this supervised learning is mainly used in our medical laboratory. The supervised type of the machine learning is mainly the use. So here we give the label data. Okay, we label the data, and then the model will predict whatever the items is there. Okay. There are basically the two types of the supervised learning. One is classification and one is the regression. So this in classification, here the model will differentiate between the healthy and disease. Okay, so like positive or negative, pass or fail, this type of differentiation can be made by the classification type of the supervised learning. While the regression that we day to day see in our laboratory, that the data, they are differentiated with the help of they are merged around the line, and that independent variable x that will help us to give a y, that is a dependent variable. So in regression, mainly we have to know that the regression class type of the supervised learning will help us to predict some number. It will give you a number, like it will predict the weather, okay, or it will predict some data. So number is given with the help of regression. So this graph will further help us to understand this supervised type of machine learning. So basically two types, one is classification and another is regression. So if we see the student profile, if this machine learning help us in predicting whether pass or fail, that will be the type of classification. Or if our type of model that will help us to predict the student marks like percentage, that is called as the regression. Right? So you can see here the supervised versus the unsupervised. So in supervised learning, we give the input data. We suppose here in this example, we give these figures are the apples, okay, and our model is trained that this is the apple. And when the apple comes, the data, the model will automatically predict that it is an apple, okay. While in case of unsupervised learning, our data are not labeled, okay. So these are different fruits like apple and banana are there. So the model will automatically, based on its feature or based on its characteristic, they will separate it into the different clusters. So here you can see here, these are apples, these are orange or banana. So like this in unsupervised learning, the data are not labeled. Okay, so this is the main difference between the supervised and unsupervised learning. So in supervised, basically the classification and the regression, while in case unsupervised learning, it is mainly a cluster. Okay. So you can see here again, in supervised learning, there is a classification versus the regression. So in regression, we get the number. So we can predict the height of the person based on the regression model, based on the grown or growing. So that is a classification of supervised learning. While in case of clustering, it will cluster into the two groups. Okay. So there are here the main difference is the data is unlabeled. Here the data is labeled. While the third category of the machine learning, that is a reinforcement learning, that is based on the actions, rewards, and observation, machine will automatically learn. Okay, so like playing games, when we lose and again we play the game, we are getting better. Like that, that is called as a reinforcement learning. So again, the machine learning, they are divided into the supervised learning, unsupervised learning, and reinforcement learning. Supervised learning can be further divided into the classification and regression. In classification, it will identify whether it is healthy or disease, like that. In regression, we will predict some numbers. While in case of unsupervised learning, mainly it is the clustering, and another is also there is dimensional reduction. So the features which are mainly used to classify the things, that are only used and other features are removed. That is called dimensionality reduction. While in case of reinforcement learning, that is learning from our mistakes. So this supervised learning is mainly used in medical research. The common classifiers or algorithms that are used, that are logistic regression, linear regression, naive-Bayes classifier, support vector machine, k-nearest neighbors, decision tree, random forest, boost trees. So I'm not going to go in details of each of these, but if you are interested, you can search in Google and you will get some idea. So these are different algorithms that are used in machine learning. Like in linear regression, the data are they are nearer to the one line, and we can differentiate. We can predict some outcome based on the linear regression. In logistic regression, from this point, suppose the data are separated either into +1 or 0 or pass or fail like that. In logistic regression, we separate. In naive-Bayes classification is mainly based on the probability. K nearest is based on the data which are near to the circle. They are classified. In random forest, it is based on the decision tree. While in case of support vector machine, the data are separated based on the line. So you need to. It will take around 1 hour to see in details about this, but you just need to know that these are the different type of algorithm or model that are used in our clinical laboratory or medical health science. This is a type of deep learning where our image, that image is divided further and go to the hidden layers, and ultimately they get the output. So it is mainly this convolution neural network, that is type of deep learning, that is used mainly in the radiology or pathology hematology. So this is a very good opinion paper. You can take the screenshot of this. All I'm sharing few references that are used in clinical biochemistry laboratories. So where is laboratory medicine headed in the next decade? Partnership model for the efficient integration of and adoption of artificial intelligence in the medical laboratory. So this is a very good opinion paper. One more is digitalization and artificial intelligence in laboratory medicine. And very good article on pre-analytical error, that that machine will identify the mislabeled samples. You can see the different algorithm like artificial neural network, extreme gradient booting, or support vector, random forest. This algorithm were compared with the human performance. You can see here the identifying the mislabeled samples. Human performance was around 77%, while this algorithm like extreme gradient boot or artificial neural network, they can identify the mislabeled sample up to the 92 to 93% accuracy. So this is an example where machine learning has outperformed the humans. Right? So another study, that is automated prediction of low ferritin concentration using a machine learning algorithm. So based on the data of the complete blood count, CBC, HB, so and CRP, a machine has identified the low ferritin value concentration, and that helps us to identify the anemia. This is another study, that is a machine learning model for the prediction of Down syndrome in second trimester antenatal screening. That study was conducted in China, and there was the human detection rate using the triple marker, that is estradiol, SCG, and alpha fetoprotein, was around 70 to 75%, while this machine learning model has an accuracy or detection rate of 85% using these parameters. This is another study that is that shows us importance of artificial intelligence or machine learning in laboratory medicine or clinical biochemistry. That estimation of low density lipoprotein cholesterol by the machine learning method. So we know that Friedberg formula or Hopkins formula that estimates the LDL level. But here, with the use of linear regression, support vector machine, extreme gradient boosting, and deep neural networks, all these algorithms were used to estimate the LDL, and with the great accuracy. Here is another article about the searching for the urine osmolality surrogate and automated machine learning approach. Here, this extreme gradient boosting approach, with the use of this approach, the different markers, surrogate marker for the osmolality measurement were counted, like conductivity with specific gravity, or conductivity with routine chemical analysis. So based on that, they estimate the osmolality. Here is another article regarding the reducing false positive results in newborn screening using the machine learning. So the different inborn error of metabolism like glutaric aciduria, methylmalonyl aciduria, ornithine transcarbamylase deficiency, or very long chain acyl dehydrogenase deficiency. So the false positive rate of this disorder were compared with the help of random forest algorithm, and we can reduce the false positive results. These false positive results may be occur due to the cutoff point between different age group and like that. So the machine has reduced the false positive results. So this is, I think, as per my opinion, the interpretation of the reports of the inborn screening and in our clinical biochemistry, this machine algorithm is very important, very useful. This is another article that is published in Clinical Chemistry regarding the using of machine learning to add the interpretation of urine steroid profiles. So the machine was able to identify the abnormal results from the normal results, and the different pathological disease like adrenal suppression or adrenal tumor or Cushing syndrome or congenital adrenal hyperplasia, etc., were differentiated or interpreted with the help, just based on the data. The machine has automatically given the diagnosis. That is the use of machine learning in the interpretation of urine steroid profile. So they use the random forest algorithm and extreme gradient boost algorithm to identify that. Another very important article, that is machine learning approach for the automated interpretation of plasma amino acid profile. So different amino acid urea were identified with the help of machine learning. Here, this study was conducted in the UK, and they have used a private software like Amazon Web Service. They are providing the machine learning. So the Amazon SageMaker is a algorithm that is a part of Amazon Web Service. They use it for the interpretation of amino acid profile. So amino acid disorders were identified with the help of machine learning. Then another study about the achieving expert level interpretation of serum protein electrophoresis through the deep learning driven by the human reasoning. So here they use the random forest and extreme gradient boost algorithm to identify the electrophoresis pattern. Mainly they identify the monoclonal gammopathy with the help of machine learning, and they compare it with the expert, and they found a very good results by the help of machine learning. Here is another study regarding the identifying the patient with the risk of cancer with the help of prediction model based on the routine laboratory tests. So based on the laboratory, they use the logistic regression model or algorithm, and based on the different our biochemical parameters like LDH or alkaline phosphatase or PSA and other routine parameters like AST, ALT, and based on that data, they were able to predict the risk of the cancers. This is another article regarding artificial neural network approach in clinical laboratory test reporting. So with this machine learning was able to give the test report, and it was found that it was better than even the specialist. Here's another article regarding the visual analytics for the predicting the disease outcome using the laboratory test result. So here they use the XGBoost algorithm to predict the acute kidney injury using the different parameters, biochemical parameters like serum creatinine, potassium, chloride, hemoglobin, and WBC counts. So based on this parameter, the machine was automatically detect whether the patient has acute kidney injury or not, and far better than humans. So this is another article that predicts the thalassemia based on the artificial intelligence technique. So based on the HB, hemoglobin, MCV, RBC, PCV, and they use a support vector machine and K-neighbor algorithm to identify the thalassemia or predict the thalassemia based on the CBC parameters. Here is another article regarding disease and support scheme for the beta thalassemia in hemoglobin E carrier. So they use a Neve-based classifier and decision tree and artificial neural network to identify the thalassemia in HBE carrier. Here is another article regarding the using of machine learning to predict the laboratory test results. So based on the lab parameter, using the linear regression and random forest, and using the scikit-learn, that is a library that is available in the Python programming, and based on the iron, TIBC, MCV, and MCH, they were able to predict the ferritin value. So both classification and regression model, like for the classification, whether the ferritin is low or whether the ferritin is high, and even in regression model was also used, and they will approximate give the value of the ferritin also using the regression model. Here it is another article regarding using machine learning to develop auto verification system in clinical biochemistry laboratory. So as compared to our rule-based algorithm for the auto verification, as we know the auto verification guideline of CLSI, so we have to check for the quality control, we have to check other delta check, everything we have to see. So that rule we can make in our laboratory. So this artificial intelligence, this machine learning model were used to auto verification, and it was comparable to the rule-based engine that we can make. Another is study is turnaround time prediction for the clinical chemistry sample using the machine learning. So there is a package called PyCaret package that is in Python, and it contains all the algorithm like K-neighbor or support vector machine or linear regression models that are present in that PyCaret package. And based on the number of the test or centrifugation time or workload or number of tests or incubation period of the test, the machine was able to predict the turnaround time for the samples. So we know that these are the different articles that are used. They have used the machine learning. So how can we use this machine learning in our clinical chemistry laboratory? So these are the two open source tools that I'm familiar with. So I would suggest the people who are interested in whose hobby is computer, so they can use this open source tool like R programming and Python programming. And these are some books that can help us to learn Python and machine learning. Another is Anaconda distribution. This is a very important distribution. It is open source, so this is available free, and it contains all the different library that will help us to predict the machine learning. So whenever we want to do the machine learning in our lab, so these are the 5 library like SciPy, NumPy, Matplotlib, or Pandas, or sklearn. So these libraries are available open source. These are free, and with the help we can use machine learning and predict data or predict disease in our laboratory also. Like this Panda is for the visualization of data, to manipulate our data. Matplotlib is for the visual presentation or graphical presentation of our data. NumPy will convert the data into the array. This sklearn, scikit-learn, this that will mainly use in the machine learning. So this is just one. I recently attended one webinar, one workshop about this machine learning, and I come to know about this how we can use this machine learning. You can see here this first three command. In programming, we have to import the sklearn, scikit-learn, that is for the machine learning. This 3 line will help us to build the model. This 3, 4, 5, and 6. This 3 line will help us this 3 line will help us to get the whatever results whatever output we want to get. So this like confusion matrix will give us idea about the sensitivity, specificity, accuracy, the precision. Okay, so these features we get, this outcome we get with this 3 line. And different models that I had talked about, the logistic regression, whatever you want to apply. Suppose you want to apply logistic regression, you have to type this command in the Linux or even in the Windows command prompt line. So here the 6 commands, 6 algorithm are used, like logistic regression, decision tree, or K-neighbors, or linear regression, Gaussian, and support vector system. So these are the commands that will help us to separate our data. Here the command, this line is used, and what happens whenever we have a data which contains some independent and dependent variable. So we have to 70% here we use the 0.3. That means 70% of the data is used for the training. So we have to train our model. So based on the training, and we have to give the, like suppose we give the 0.7 or 0.8 and give it for suppose one value which has a 0.5 value, we have to give it, it is a positive for some disease, or 0.1 is negative for the disease. So machine from the data, 70 or 80% of the data is used for the training. Then the 20% of the data is used for the internal validation. And then when we feed the data externally, or then we have to perform the external validation. Then a machine will automatically give you interpretation, whether like in amino aciduria or inborn error of metabolism. So we feed the data. It is divided into the 80% into the training model. Then 20% will be used for the internal validation. So after the internal validation, the algorithm will give you the sensitivity, specificity, accuracy, precision, everything, the data. And based on that, we use the base model. We select the base model that will be used for the external validation. So whenever the next data comes, the machine will automatically give us the interpretation. Now, what are the challenges? So our laboratory physician, there may be chance of the de-skilling. There will be the uncertainty or the black box model, that is a lack of transparency. So we don't know exact in detail about how these machines are going to give us the data. So there is always a black box model. There may be the chance of ethical issue, that model can be discriminate the things, or there can be a privacy issue. The data security is the main issue, sustainability, because these machines are as good as our human. So whenever we are training that model, good knowledge of the expert is very essential. If it is not there, so data quality and sustainability is very important part of this machine learning. So the expert, whenever we are training this model, the expert human is required, and so that we can get the best outcome. Also, in developing countries, we have an insufficient infrastructure. That may be the challenge in our artificial intelligence. So how we can optimal way of implementation of machine learning. So best attitude to utilize machine learning is to augment our laboratory physician performance and decrease the inter-observer variability. Instead of replacing the human, we can, with the help of machine learning, we can augment our lab physician performance and decrease the inter-observer variability. It should be the human and artificial intelligence combination. So ideally, the hybrid intelligence should be used. So we have to not rely on artificial intelligence. Human is also required. External validation, whenever we do, it should be conducted ideally at the different location. The comprehensive performance evaluation should be conducted before the deployment of the machine learning. And as AI, artificial intelligence, come into the mainstream, organization must adapt to reap their benefits. So finally, to conclude, the effective collaboration between the data scientist and clinician is essential in obtaining clinical useful models. However, laboratory medicine professionals should gain a thorough understanding of big data and machine learning algorithm to understand their potential and correctly interpret their results. So the Stephen Hawking, a famous physician, a famous scientist, who quoted that development of full artificial intelligence could spell the end of the human race. He said in terms of that there will be a chance of the unemployment occur. But if we use it properly, we can minimize the errors in our laboratory and we can better use in our health science. So this is my photograph that I have taken after interfacing the medical equipments with the help of Python in our laboratory. So we can see the Abbott Architect machine, the Beckman Coulter immunoassay, even the ABG analyzer, ABL radiometer, and in the Mindray BS230, that machines were interfaced with the help of my guide, Dr. Shailesh Patel sir, and we have interfaced the different medical equipment, including the pathological Horiba cell counter also. And recently, just 2 days back, where I had installed the in-house LIS, the new machine came, that is a Roche Cobas C311, and I guided remotely, and we could interface in the Roche Cobas C311 also. And Python programming that is using mainly in the machine learning, even from our laboratory data, we can from just within a 5 to 10 seconds, with the help of R programming, we can derive the reference interval, or we can verify the reference interval. So this is a cosmic program that was developed by the German scientists, Dr. Zerk, and he used the Python programming to develop the reference interval or estimate the reference interval, and it is mainly used in the deriving. It can be used in the pediatric reference interval. And another important algorithm, that is refine R, based on the R programming. It was again developed by the German scientist Tatjana, and I'm working few projects with the help of this cosmic deriving reference interval or verifying reference interval with the help of this R programming and Python programming, and we can derive the reference interval or within a 5 to 10 seconds, even 50,000 data within a few, with the help of few commands in the 5 to 10 seconds, we can derive the reference intervals. Thank you very much, and I really congratulate the organizers for arranging this CME, and it will be beneficial or knowledge enhancing for all of us. Thank you very much.